Yes, hi, this is Professor Grodman. In the Psych 11102 section, we just had a little technical issue with our sound, and we're not sure why, but here is a YouTube audio review, so this should be sufficient. Um, I guess we'll assume we're still going to try WebEx again for exam three. But again, if it doesn't work, we could maybe go to audio, but um, there's always this backup, which is nice. Okay, so. You guys are responsible for chapters 4 through 6. Dealing with chapter 4 deals with consciousness, chapter 5 dealing with learning theories, and chapter 6 memory. So let's get to the sort of the nuts and bolts of it. Circadian rhythm. This is your biological sleep-wake cycle, and it is actually a cycle organically that's pretty consistent with the artificial 24-hour cycle. And how do they know this? Well, they've done some research involving people who they were able, I don't know how they got this population, but they did get a somewhat representative sample, if you will, of people who they put in settings with which were devoid of light and time cues, observed their behavior over time, and then were able to calculate that their daily waking and sleep behavior was about 24 hours and 18 minutes. So again, fairly commensurate with the artificial 24-hour cycle. Okay, speaking of sleep, uh, sleep is, there are many stages of sleep, but let's focus on a few terms. And one term is REM sleep, rapid eye movement, the acronym REM, and that is tied in with dreaming. Almost all of REM is dream related. In adults, it's about 20% of sleep. In infants, we'll go through this, it's a bit more, actually about 50%, but we'll outline that. Non REM or NREM does not involve sleep, and in adults, 80% of sleep. So, what are sleep requirements? Well, interestingly, sleep requirements get less as you get older. Infants require the most sleep, about 17 hours. 50% of that is REM. By the time you're 4, you're down to about 10 hours, 25 to 30% REM. In your adolescence, your teens, throughout much of your adult life through age 65, 7.5 hours, 20% REM. Late adulthood, 65 plus, specifically about 6.5 hours and 20% REM. Now, there is individual variance here. If you're saying, well, I sleep more or less, that's not unusual. These are averages, and there's quite a range. If you were to look at sleep and say, okay, like most things in moderation are usually healthful and optimal. Sleep works the same way. If you get too little or too much, it tends to work against you. And there are many sleep disorders. Let's just highlight a few. Nightmares, which are pretty self-explanatory, are associated with REM sleep. And actually, there is something that are referred to as sleep or night terrors. These, when they've done sleep studies, they've actually found these are very distressing episodes in which someone finds themselves waking out of a sleep and feeling uncomfortable, maybe even having a really strong negative emotional response. But one of the issues here is not only that, but also there's no explanation or attribution for why they are experiencing this dissonance or discomfort. And in fact, they're not dreaming. Their sleep studies that I referenced before do not suggest they are in REM sleep. They're in non-REM. Sleepwalking, more common in children, as are nightmares, by the way, also are non-REM sleep, associated with non-REM sleep. The effects of sleep deprivation are many. They really are on multiple dimensions. So there are cognitive effects of deprivation. For example, memory, attention, concentration can be diminished. Physically, your reaction time to things, your even health, it suppresses the immune system. And emotionally, you're prone to irritability. So there are a lot of negative effects of sleep deprivation. And I guess you could also define or break down sleep deprivation into more acute sleep deprivation, short term, which can be very significant. But even more significant potentially is chronic sleep deprivation. And you probably have heard maybe the term or may have used it at some point, sleep hygiene. And there is evidence that people who sleep optimally seem to do better psychologically, physiologically. And Why is that? Well, because there's a lack of sleep deprivation, and sleep promotes heart health and brain health and all those things, emotional health, and mood affects sleep as well. So if you're depressed, for example, you tend to sleep more. But there's also more evidence that sleep affects mood, as I just indicated. Um, there are many theories on dreams. Now, a lot of dream research today is more empirical, more scientific, and quantifiable. But there is also the old Freudian perspective on dreams, that they're symbolic, they're a pathway to the unconscious, that they are meaningful, very much so. And Freud said that our dreams are really important, but also very threatening. So if we were to be aware of our dreams when we wake up, it would make us, it would make us feel uncomfortable psychologically. So how do we sort of work against that? How do we deal with that or cope with that? Well, he says we dream in a symbolic way, so that if you're dreaming of the water, it may not be that you're taking a trip, but rather you want to regress to the womb. Now, to know that consciously would be very hard to sort of negotiate. So that's why, according to Freud, we dream symbolically. The Freudian perspective, as mentioned before, has lost a lot of luster. So that dreams are not, sort of in clinical psychology and psychiatry, dreams are not sort of the first go to. It's often a therapy session might involve some investigation of a dream, but usually that's more secondary. And the focus there would be how the dream connects to your contemporary life. So that if you have a dream about your boss, it's not viewed symbolically as a father or mother figure, but rather as your boss. Many societies look at dreams as spiritual in nature, and not psychological. If you looked at sort of the cross-cultural research, you'd find a lot of that. And the least ascribed to, I just sort of outlined four, we're talking about four dream theories: the Freudian perspective, the more contemporary perspective of dreams being an extension of everyday life, the spiritual, and the least ascribed to is the fourth one, that they're purely biological, random neuronal activity. That's not widely held. Even physical scientists are not supportive of this. Okay, just a brief discussion regarding psychoactive drugs. You should know that the distinction, or discriminate, using a classical conditioning term, by the way, between physical dependence and psychological dependence. Many drugs are psychologically, one can develop a psychological dependence to. For example, marijuana or cannabis. Many times alcoholics report having a psychological and behavioral addiction, but not being physically addicted. Physical dependence or addiction requires tolerance. You need more and more to get the same effect. And you also typically have withdrawal, where you crave the drug, or are nauseous or really uncomfortable if you stop using it. That's physical dependence. Psychological dependence is more obviously in your motivation for it, but it's not physiological. And of course, people who have a physical dependence, not surprisingly, have both that and a psychological dependence typically. A few categories of drugs, just to mention. There are stimulants, which increase energy, arousal, like cocaine, nicotine, caffeine. They often reduce appetite. Alcohol is considered a depressant, and it is, again, can be physically addictive, but often is not. Opiates reduce pain. Examples of opiates include opium, morphine, and heroin. Cannabis, another name again for marijuana, is considered sometimes a mild hallucinogenic. A hallucinogen, though, is much more extreme, like LSD, and grossly affects perceptual and sensory experience. There is also a clinical term called a dual diagnosis, and this is where someone has a psychiatric and a substance abuse diagnosis, and this is typical. If you have, for example, if you have alcoholism, you often have depression, or you very well may have depression. They're highly correlated. It's not a 0.90 correlation, meaning 90% of the time, but it's pretty high. So just to mention that. All right, let's switch gears and talk about learning theories, starting with Pavlov, the father or pioneer of classical conditioning. Pavlov is associated, remember the paradigm of Pavlov and his dog, that, and this gets a little tricky in terms of the terminology, so you may have to go over this tape or the book or a combination. Often multiple modalities often are the best. Anyway, the meat, remember the meat powder is introduced to the dog. The meat is called the unconditioned stimulus, or the UCS, producing the unconditioned response, or the UCR. Then they introduce a bell to the dog, and the dog does not salivate. There's, by the way, some sort of metric on that they use that measures salivation. They have something on the dog's snout. If you have a dog, you may notice that they actually do bark at the sound of a bell because there is some learning there. There is conditioning associated with that. But if the dog had no exposure to that, I don't think organically they would bark at the bell. And in this case, they didn't salivate at the bell. Now, how do you get the dog to salivate at the presentation of a bell? Well, you combine it or connect it to pair it with meat. Bell meat, bell meat, bell meat. You take away the meat. The bell alone produces salivation because it's associated with the meat. The bell now is called the conditioned stimulus. The response to this, the conditioned response. If, however, you present the bell enough times without, or they call them trials, without the meat, that association weakens, and this is referred to as extinction. And we have this in our lives all the time that you push a button, you get a shock, and you go back and you push it again and again and again. You don't get a shock. Eventually, it goes back to being that button. It's no longer connected to that shock. That's extinction. They did find, though, with the dog that they kept this, I think they kept monitoring the salivation response. And eventually, there was a little bit of salivation from the presentation of the bell many, many trials later, even beyond extinction. That's called spontaneous recovery, and it often happens only one time. Okay, well, to give you a historical context, Pavlov was a Russian physiologist in the 1890s. We're going to move 30 years ahead to Baltimore, Maryland at Johns Hopkins University and talk about John Watson and Rosalie Rayner. They were researchers at Johns Hopkins, and they basically were the first ones to classically condition an emotional response in a person with a very limited or minimal learning history. Little Albert, he was, I think, the secretary of the department's son, and they weren't going to use the same Pavlovian meat dog thing or meat response, but rather they used loud noise as the unconditioned stimulus, which produced crying or fear in this child. And then they introduced the rat to a child. And the child has no learning history about rats, so it was neutral, not much of a fear response. And then they paired the rat and the noise many times over, took away the noise. Guess what happened? The rat produced fear. And that the rat was a conditioned stimulus now, and the fear response, the conditioned response. Something I don't think they planned on, and something called generalization. And that is, little Albert started responding to anything resembling a rat as if it were a rat. Mink stole, believe it or not. That time they were very in vogue, in fashion. Guinea pigs, cats. That's generalization. He also was not able to do something called discriminate or engage in discrimination. That's when you're able to decipher between similar stimuli. And that is something that probably developmentally couldn't do. He was too young. So if you're able to distinguish between Carvel ice cream and Dairy Queen ice cream, that's discrimination. Or if you see them as the same, that's generalization. Okay, let's move ahead another 30 years. We're still in learning theory and still under the realm of heading of classical conditioning. And something called systematic desensitization associated with Joseph Wolpe, Wolpe. This, they knew for a while, since I think around the 1920s, that if you have a fear, the way to reduce that specific fear or phobia is to expose yourself to it over and over again. Well, Wolpe knew that, but adds one more dimension. He figures, okay, that works. Why don't we add something that counters the fear? And it's called counter conditioning, relaxation. So he involved two things: exposure, called actually graduated exposure, and counter conditioning, relaxation. And so if you have a fear of heights, for example, this is what he did. He developed a fear hierarchy from, let's say, the least threatening fear of heights, 1 foot off the ground, all the way up to being on top of a building, and would actually take the client through it, relaxing them and then exposing them. Then the next step, relaxing, exposing. This is systematic desensitization. And there are two ways of doing it. The most effective is called in vivo, IN-VIVO, systematic desensitization. No substitute for experience, and that's what in vivo is. Sometimes people have such fears of things. Flying is a big one. I've encountered this with people that I've worked with, that there's just no way they're going to do it. So they'll use something called imaginal systematic desensitization. Just adding a point separate from Wolpe regarding exposure, there's another type of exposure that's really, I guess, sort of like the most desperate, most extreme, and it's called flooding. And that is if you're exposed to a stimulus all at once, like heights, the top of a mountain, and you're not allowed to leave, and someone sort of will talk you through it, but that's a really sort of drastic way of trying to, try to combat your phobia or fear. Okay, we're still in learning theory. We're going to move on to operant conditioning associated with Skinner. And B.F. Skinner was influenced by someone by the name of Thorndike, or Thorndike's law of effect. And the basic law of effect concept is that behaviors followed by positive consequences are strengthened and negative consequences are weakened. And Skinner sees this and says, okay, this makes sense. Behavior, you can if you use the term reinforce, you'll see an increase in behavior. That's positive reinforcement, a positive behavior following, positive consequence following a behavior. And that'll increase the behavior. That's positive reinforcement. There's also something called negative reinforcement. And that is if you take away, if you work hard and get an A, that's positive reinforcement. If you work hard and don't get an F, you're taking away that negative, that's negative reinforcement. You actually can have the same behavior result in both negative and positive reinforcement, but both result in an increase in behavior. If you were to get yelled at, it would not necessarily eliminate your behavior, but it might reduce it. That's punishment, when a negative consequence follows a behavior. Skinner was particularly interested in positive reinforcement, and he said there are generally two types, partial and continuous. And he said, life is such that partial positive reinforcement is more likely. And he breaks this down into four types of partial positive reinforcement. And you should know that a ratio, there are two terms you should know, ratio and interval. Ratio has to do with number of responses. Interval has to do with time. So, okay, that said, if you have a fixed ratio, it means a fixed number of responses. You knock on the board and you get a candy bar after you knock every 4 times. Assuming you like candy bars, that's a fixed ratio schedule. You're getting reinforced. Fixed interval would be a fixed amount of time, like a certain amount of money per hour. A variable ratio would be a varying number of responses. The classic example here is a slot machine. You get it in 3 pulls of the lever, 7, 2, 9, 12. And this is the most resistant to extinction. Again, that term extinction is used here as well. And that is the person, it could be an animal actually, not with a slot machine, but with other things. And they'll continue the behavior because they don't talk about cognition. They talk about expectancy, that the next one's going to bring the reinforcer. And lastly, there is something called the variable interval schedule. You reinforce based on a varying amount of time. So you should know those 4 schedules of partial positive reinforcement. One more thing about learning theory. We're talking about learning theories that are these are non-biological. This is before they realized about the brain and behavior. And they're non-cognitive. They don't consider the mind or the brain in any sense, except the guy named Albert Bandura out at Stanford University in the 1960s came along and said, well, what about indirect experience? Skinner and Pavlov, all these people were great, but what about observing something? What about, they didn't have YouTube videos, but what about watching something and modeling that behavior? Doesn't that happen? And he believed this does and did, and he's considered the father of social learning theory, and postulated that there is a lot of learning that occurs indirectly, and that this is the dirty word for Skinner, that cognition may be a part of this. You may see something and say, I don't want to do that, or I do want to do it. So this departs a little bit because it involves not only indirect learning, but also cognition. Okay, so that was chapter 5. Now let's get into chapter 6. And this is going to be sort of brief. There are different types of memory. And let's start with the shortest type, sensory, literally a split second, processing of something for a split second. There's also something called short term or working memory, like a telephone number, 2 to 30 seconds. And then long term memory, obviously, something longer, usually days, months, years. And learning involves this transfer of information from short term to long term memory. Is there a way to learn more effectively? Well, there are many sort of suggestions, but the research sometimes breaks learning. If you want to sort of look at this transfer into maintenance rehearsal and something called elaborative rehearsal. Maintenance rehearsal has to do with saying something over and over again, just like memorizing a poem. That's very hard. It's doable, but hard and not very efficient. More likely, you want to look at elaborative rehearsal, where in which you connect things you know with new information. It's more meaningful. You know someone who's depressed, and so when you study abnormal psychology about depression, it's easier to learn that. I always say to students, what's the easiest level of school? Does school become more or less difficult as you move up the ladder, so to speak? Is high school easier than graduate school? The answer is no, it usually is not, because high school consists of everything. It's very broad. The breadth of it is great. Graduate school is very narrow and involves much more elaborate rehearsal because you're taking things you're interested in. That's much, much easier. Okay, moving on to the next, some additional concepts. Recognition memory involves cues, like a multiple choice test. I can talk about sensory memory in short term and long term. That has a lot of cues and triggers. Recall memory doesn't have that. Just tell me everything about memory is a lot harder. That's recall memory. We also learn better, not learn better, we retrieve information better if we've learned in that same place. So if you study in a certain room, you'll actually remember better in that same room because of cues. There are two names for this. They used to call this state-dependent learning. They now call it encoding specificity. We also, let's do a little experiment with memory to give you an example of what I'm about to say. I'm going to say some numbers, and after I'm done, maybe you say them after me, or maybe you don't. But let's make a go of this. 7, 5, 3, 9, 7, 1. You're more likely to remember the 7. I didn't give you much time to repeat that, but you're more likely to remember the 7. And there's a name for that. They call that the law of primacy, the first thing. And you're also more likely to remember the last thing. That's called the law of recency. And this applies not only to short-term memory, but also long-term memory. We're also more likely, if we've been exposed to something before, to remember it better. This applies to long-term memory. And this is referred to as the method of savings. So if you take a foreign language or second language when you're 12, and then you're take it again when you're 20, it'll actually be quicker to learn it the second go-round. That's the method of savings. By the way, that example I gave you in terms of the primacy and recency effects also is an illustration of something called the magic 7. I think I gave you 7 digits. Usually you can remember about 7 digits in memory, short-term, it's referred to as auditory short-term memory. This is connected to someone by the name of Miller, George Miller. Now, when you look at your life and the events of your life, how many days do you remember with great clarity and specificity? Probably not as many as you would think. And we tend to remember things that are dramatic, that are unusual, unique, not traumatic, but dramatic again. These are called flashbulb memories, where there's great clarity and specificity. There's also a phenomenon in memory that memory tends not to be very accurate or objective. It tends to be highly subjective. So if you were to think back to an earlier time, you might actually be remembering something that wasn't exactly the way it was, because you may reconstruct the memory. For example, you go on a trip and you're saying, okay, it was a pretty good trip. And then you start to talk about it with people, and you find yourself remembering not the trip, but your account of the trip. And this is called constructive processing. You're basically reconstructing the memory. We do, though, forget. We forget a lot. We forget for specific reasons. Sometimes this is called decay of memory. And we forget because of a lack of use. of something, like a language, a lack of cues, maybe you just don't see it. And another reason, it's called interference, overlapping memories. And think about it, you're in sales and you meet 100 people a year or 500 people. Do those people start to affect your ability to remember other people? Probably, particularly over time and over the huge numbers of people. And especially people who are similar in name or physical or behavioral appearance or mannerisms. And there are essentially two types of interference. Something called proactive interference, where something from your past affects your present. So you took a course in sociology last year and affects your ability to remember in psych this year, because those are two related courses, somewhat related. More likely, though, is something called retroactive interference, where the psych course now affects your ability to remember the soc before. That's more akin to the example I gave with regard to the people in the sales example. One other reason why we forget, neurobiological factors, just maybe in part aging, but more likely, diseases like Alzheimer's and other forms of dementia. So anyway, that pretty much is a summary of what we've already gone through. I hope it helps. In the Psych 11102 section, my apologies regarding WebEx, but I think that should be of help. If you want to email me, feel free. I will put out for both classes, well, actually, this pertains, will eventually pertain to Psych 11101, but I will say for both, you'll have about 12 to 24 hour period to do the exam once I submit it, the date of. So for the 11101 section, that will be tomorrow, June 17th. I will post very early, I'll post it on Blackboard very early tomorrow or late tonight. Okay, look forward to your responses and getting your emails in terms of your answers, your responses. Okay, take care.